Whether it's tennis, golf, pickleball, paddle, padel, which I played this weekend down in Miami, fishing, volleyball, all those sports and many more, you need your hands. And for the active community here in Palm Beach County and the surrounding areas, we got so many people doing so many active things in their life. And that's why I'm so excited to bring on our next guest. This is Dr. Keith Raskin, a well-known and renowned hand, wrist, and elbow surgeon in New York City, specifically Manhattan, on Madison Avenue in between 51st and 52nd. And also, he is now at the Paley Orthopedic and Spine Institute at St. Mary's Medical Center in West Palm Beach. Dr. Raskin has successfully treated numerous professional and amateur athletes, musicians, artists, sculptors, actors, surgeons for potential career-affecting and career-ending injuries and conditions. Dr. Raskin joins us now to talk about a slew of hand, wrist, and elbow injuries in pro sports, including Tyler Herro's broken fingers, Jaden McDaniel's reported hand injury, and Astros' Jose Altuve's broken thumb. But Dr. Raskin, before we get to those guys, I want to go back in time a little bit to quote former Yankees first baseman and World Series champion Mark Teixeira, because you did surgery on his wrist back in 2013, which helped him lengthen his major league career. And Teixeira said, and I quote, "I've had knee surgery, I've had ankle surgery, I've had surgery on my shoulders and my low back. You can play through all that. The wrist is the hardest thing by far that I've ever had to go through," end quote. So, doctor, I want to start there and just ask, why is the wrist injury and, let's say, subsequent hand injury just so damn tough to deal with?
Well, that's a great question. I think the major factor is what originally drew me into the field of hand and wrist surgery, which is the complexity of the wrist. And if you look at a lot of other joints in the body, the main function is bending, open and close, whether it's your knee or your elbow, and even the shoulder is just a single ball and a socket. And that's not to take away from those joints or doctors who treat those joints, but it's certainly not quite as complicated as the wrist joint, where you have, in essence, 15 bones that are meeting at the wrist, and then through those bones, a variation of motion. And you think about different athletes and what they have to do, and each athlete has something different that's demanding. And you look at Tex, and he is a power hitter, but he's a switch hitter. So he had torn a tendon sheath in his wrist, which means that he has a very high demand on that tendon staying in place, both when the wrist twists forward, which is called pronation, and when the wrist twists backwards, called supination. And to be a power hitter at Yankee Stadium and be able to hit out of the park on either side of the plate really takes a high demand, especially when it comes down to soft tissue injuries.
We'll get back to a few more Yankees questions a little later, but I want to get into some of the more recent injuries, starting with Miami Heat guard Tyler Herro, who reportedly broke the third and fourth metacarpal on his right hand while diving for a loose ball in Game 1 of the first-round series against the Bucks. Herro reportedly had surgery to fix the injuries, but he is unlikely to be back for the playoffs. And Dr. Raskin, I was wondering if you could just explain where the metacarpal is found on the hand, where it's located, and also the type of surgery that is needed in order to repair, again, the third and fourth metacarpal bones.
Sure. So metacarpals are the bones that are most noticed when you make a fist, because that's what makes up your knuckles. And those are the head of the bone is what protrudes, making the round surface of the knuckle. In essence, the metacarpal attaches the fingers to the wrist. So when you start talking about a hand, hands are mostly metacarpals, and those are 5 bones that connect the fingers onto where the wrist will attach to. Now, I saw his injury, and it looked like when he hit the floor, there was not only just an impact, but a twisting injury to it. So when patients and players get injured, they're often surprised that it's not necessarily an impact that causes the break, but the torque. In other words, if you were to twist your finger when you fall, that causes a spiral break in the bone, which means that the bone has a long fracture line and may very well be shifted out of place. And anytime you break two bones, especially if they're adjacent to each other, you're at a higher risk of having an unstable injury. In the lower extremity, it's almost like when somebody has a tibia fracture with the fibula. So somebody may say they had a ski injury or playing soccer, they had a tibial fracture. Those injuries are more unstable. So for the metacarpals, the fixation, the surgery for that would require usually a small incision and then either a series of screws and plates or a wire to hold the bones. And most likely than not, it was screws and plates. And those fractures take roughly 4 weeks to heal. Maybe sometimes they could heal a little bit faster depending on the fracture configuration. Is it broken straight or is it broken into many pieces? Or it could take longer, maybe up to 6 weeks. But don't forget, on a professional level, it's not so much the healing, but it's the recovery.
Mm-hmm.
So I try to make it clear to these players, listen, the body part is what heals. The patient has to recover. So you don't get your X-ray and go, wow, it's healed, and then you get back out
Right.
there and you're back at 100%. So obviously it's an important time, and when players are under the gun, sometimes we have to get them moving and recovering a little bit faster than normal, but oftentimes with the right type of support or taping or wraps, we can get them going.
Again, here with Dr. Keith Raskin, well-known and renowned hand, wrist, and elbow surgeon in New York City with offices on Madison Avenue, and he is now down in West Palm Beach working at the Paley Orthopedic and Spine Institute. And Dr. Raskin, I often joke with the medical professionals that I speak with that the time frame, the recovery, and the return from an injury are very different for a professional athlete versus the average person or the weekend warrior. For Hero, this injury might keep him out 6, maybe 8 weeks. But for me or for you, what would the timeline of the recovery be for a surgically repaired metacarpal?
Certainly, again, I'd want to see it show X-ray healing within 4 weeks or 6 weeks, and then have them start exercising and moving the fingers, and of which the most important in order is going to be, number one, getting back the range of motion. So once you get the range of motion back, then we could start working on number two, which is, the strengthening. And then at some point, I usually tell the players that you're no longer, in need of hand therapy or hand rehabilitation. You're in need of getting back into fitness for whatever your position is.
Right.
And sometimes I'll say to them, now you have to get back to being a first baseman, for the Yankees. You have to get back to being a point guard for, whatever basketball team you're on. So you have to condition. And fortunately, nowadays, it's come a long way than it has, back in, 20, 30 years ago. But these players, a lot of the premier athletes have conditioning coaches, stretching coaches, strengthening coaches. So they have different availability, which along with their level of function preoperatively really helps move them along quicker than you or I.
Again, here with hand, wrist, and elbow surgeon, Dr. Keith Raskin. And there was another player in the NBA playoffs, Jaden McDaniels, who suffered the same injury as Hero, breaking the third and fourth metacarpals of his hand, but did it in a different way. He actually punched a wall in frustration, and he is in a cast, out indefinitely. Dr. Raskin, I'm curious, how is a surgical approach versus a non-surgical approach determined in the treatment of a metacarpal fracture?
God, you can't believe how many times I see that injury, by the way.
Yeah, I'm sure.
And more often than not, you get away with it. But sometimes you just hit something a little firmer than you expected, and your adrenaline is pumped up, and you drive your hand into a wall, and you regret it quickly afterwards. So the fracture configuration, if you hear a doctor say the fracture is non-displaced, that's an important factor. In other words, the bone broke, but nothing shifted. Sometimes I give a visual like you can crack an egg, but nothing came out. That's a non-displaced fracture. And oftentimes, impaction fractures are non-displaced or stable, so that could be good. Even if it did displace, it may have just pushed it in a little bit, but did not shift it out of place. And that's a great one that just takes a cast in time, and they usually fully recover. It's interesting. We coined a term for that injury called a boxer's fracture. And what's interesting about it, it happens in anyone who's really not a boxer. You would never see that in a boxer. And that's because, professional boxers, if you ever saw them wrap their hands and how they're padded and how they're protected, they literally would never come down with that type of injury. Very, very rare. So if a fracture is non-displaced, or if you hear that it's minimally displaced, or even if it is displaced but it's stable, so it's not going to shift, those are fractures, everybody's happy because we could treat them in a cast instead. Now, sometimes fractures are slightly displaced, and perhaps in an amateur or in a non-athlete, we could treat that in a cast or a splint, but the duration of time is going to be slow. That's common in the wrist. So oftentimes there are bones in the wrist. There's one called the scaphoid bone that can heal on its own, but that may take anywhere from 12 to 16 weeks of healing, whereas we may go ahead and recommend putting the screw in and then letting the athlete play with protective, tape and wrapping on it, and have the screw act as an internal cast because it's holding the two pieces of bone together, and get them back, sooner than later.
Again, here with hand, wrist, and elbow surgeon Dr. Keith Raskin. He's got offices in Manhattan on Madison Avenue in New York City, and also he is down in West Palm Beach working at the Paley Orthopedic and Spine Institute at St. Mary's Medical Center. So, Dr. Raskin, last thing with the NBA before we move on to some other sports. Ja Morant, his injury was the big news early on in the playoffs in the Western Conference, and Morant reportedly hurt his hand attempting a dunk against Lakers center Anthony Davis in Game 1 of their series. X-rays were reported to be negative, but Morant missed Game 2 with a soft tissue bruise and was appearing to wear a glove to protect his hand. So, Dr. Raskin, I'm curious, what are the causes of a soft tissue bruise, and why is it important to get an X-ray for this ailment and be treated?
That's a great question, too, because I actually saw that injury as well. And it looked like he was grabbing his hand a little bit more than the wrist. So that could be a good prognosis because a lot of those ligaments are less functionally demanding than the wrist itself. They have him wearing a glove because oftentimes a compression glove will help you with the obvious problem, which is going to be swelling. So swelling is a limiting factor because that's going to lead to more pain and more limitation of motion. But you're right, the initial X-ray is important, but equally important, obviously nowadays, is the MRI. So MRIs are a great diagnostic tool as well as ultrasound for soft tissue injuries, determining is it a strain. Now, strains are usually tendons. Tendons get strained, or a sprain. Sprains are usually ligaments, and they're graded in grades 1, 2, 3 in severity. Or is it in fact a partial tear? So we'll have players throughout the levels, whether it's high school, college, or pro level, that we may even think an injury is more severe than what we would normally say is acceptable to continue playing. But in a playoff situation or at the time of need, we'll try to wrap it up or get it compressed until the time comes at the end of the season, and that's when everybody comes in for definitive care. And hopefully he can progress to heal even while he's playing. So don't forget, there's a lot of time off the court, and that's when we would wrap him up a little bit more aggressively, keep ice on it, keep it elevated, and try to get everything under control for the time that he needs to perform.
Again, Cyrus Wittig here with hand, wrist, and elbow surgeon Dr. Keith Raskin. And Dr. Raskin, moving over to the MLB, The defending AL champs, the Houston Astros, have been without their star second baseman Jose Altuve after he was hit by a pitch and broke his thumb during the World Baseball Classic. Altuve has missed the first month of the season and said earlier this week that the next 2 weeks of his rehab will be very important to him getting back on the field. So, Dr. Raskin, when is surgery needed for a broken thumb, and what are some of the treatment options available for thumb injuries today?
Sure. That injury is a little bit more severe than you would think, and it's based on the velocity of that pitch. And I got to see that image of the video watching him get hit, and that was a direct shot right onto the thumb. And with that, you have to be very cautious because of the demands on the thumb are different than the other digits or the wrist. So, the thumb's going to be involved not only in holding a bat, but, throwing a ball or catching. There's a lot of demand that's isolated on that single finger. Now, the thumb can fracture in a way that it'll either break through the bone or it may be a term of what's called an avulsion fracture. An avulsion fracture means that the ligaments that attach to the bone actually pull off a piece of bone due to the force of the impact. And sometimes for a visual, I tell patients, when you want to think of an avulsion fracture, think of a boat tied at a dock and somebody didn't take the rope off. And as the boat pulls away, it actually pulls a piece of the dock off. That's an avulsion fracture. So the important point there is understanding the anatomy. And obviously, he has to be treated by a specialist who knows this, that the piece of bone may actually have a critical ligament attached to it. And we see that in baseball players a fair amount. We see it in football players. Drew Brees had that injury to his thumb on his throwing hand, had to have a bone anchor put in to reattach it and have the ligament supported with additional internal tape to hold the ligament and support it so he could get back and throw a football faster. So you're right. The thumb takes up its own category of injury, and certainly in the professional athlete gets everybody's attention. And then that's probably the duration of the time needed that he's out for that 2-month period. But again, don't forget, he's going to heal. He may not be back in that top form for quite a few weeks or months later until he starts to get that strength back up. Don't underestimate the significance of loss of strength when it comes down to a pro athlete.
Again, here with Dr. Keith Raskin, hand, wrist, and elbow surgeon with the Paley Orthopedic and Spine Institute at St. Mary's Medical Center in West Palm Beach. Dr. Raskin is also well known and renowned in NYC for all of his work up there. And Dr. Raskin, we talked and started the segment talking about, the active community down here in West Palm Beach and the surrounding areas and all the things that they get up to: tennis, golf, paddleball, pickleball, fishing, everything. What are some of the most common hand injuries, hand, wrist, and elbow injuries, I should say, that you see in relation to adult sports here in South Florida?
I think of all the states in the country, and believe me, I've been in practice for a long time up in New York, which has its share of golf courses and tennis courts as well. But golf in Florida, I could probably limit my practice to that alone, and I'd be way too busy already. And it's all levels, from the beginner or the amateur, the local pros or the touring pros. It's just so demanding, especially on the wrist. And between the wrist and the elbow, a lot of soft tissue injuries can occur. And again, no different than with tennis and now pickleball. I'm seeing more and more patients on a regular basis. And a lot of it is, you have to remember, as we're getting older, and a lot of even the former athletes still want to keep active, but as they get older, you have to be cognizant of two factors, which I'm always pretty demanding on my patients, which is duration and frequency. So I understand you're retired or you're slowing down and you want to play, but if you're telling me you're going to be golfing or playing tennis or playing pickleball every single day, without rest, and maybe even, maybe both. Some guys are teeing it up in the morning and then playing pickleball in the late afternoon. You're putting a lot of stress onto the wrist. There's soft tissue in that area of the wrist closer to the pinky, which is it's an abbreviation called the TFCC. That's the triangular fibrocartilage complex, and that's the equivalent of the meniscus in the knee. So we all know people have had meniscal tears in the knee. They all had cartilage injuries. They may even have ACL injuries. Well, it's no different in the wrist. That's a very common problem for me. And then obviously up above that is the impact and the force that you feel for golfer's elbow and tennis elbow. And don't think they're mutually exclusive of each other. I have a lot of golfers who come in and they almost are apologetic. They go, Dr. Raskin, I'm sorry, but I have pain where they told me it's tennis elbow, and I don't play tennis, I play golf. Right. So tennis elbow is more on the outside of the elbow, while golfer's elbow is on the inside of the elbow. But it's the same point it's the attachment spot where the tendons attach to the bone. And more often than not, they're chronic problems. It's not something that happens on a given Thursday and you come in to see me on Friday or Monday, but it's more of something that's been lingering, and people are trying to get better with Motrin or Advil or other anti-inflammatory medication, but sometimes the pathology just gets to that point that they need further treatment.
A couple more things here with hand, wrist, and elbow surgeon Dr. Keith Raskin. And Doctor, you mentioned that you spent a lot of time working and practicing in New York City, and I was wondering if you could share a little bit about your experiences in Manhattan before coming down to Florida and, of course, working with the Paley Orthopedic and Spine Institute at St. Mary's Medical Center.
Sure. Well, I did my training in Washington, D.C., and then in Baltimore, and then back in New York, and I've been back in New York for over 30 years in practice, treating just hand, wrist, and elbows. And I always thought one thing that was an advantage in New York, as opposed to all the disadvantages people may think, but gosh, I probably have close to 12 million people who could get into my office within a half an hour. And that's sort of like its own little country. I mean, it really is the capital of medicine. There is a lot of people who come to New York, and then from there it expands tremendously. And I've been fortunate enough to see patients come in to see me from all over Europe and South America and South Africa and even Australia, athletes that have come in to get care. And I think it's recognized that New York attracts a lot of the patients in need of subspecialization, and that was my main focus and my interest. And I would have to say that over the past couple of years, there's so many people who have been moving into the Florida state, and the demands and the requests for people asking me to find them a doctor here, or how come I'm not down here to help them during the off seasons or when they're down in the winter, along with my long-standing friendship with the group at the Paley Institute has convinced me to divide my practice and spend my time down here as well as in New York. And certainly interesting for me after all these years, now having, in essence, two real full-time jobs on part-times. But I'll tell you, with modern technology and what we have available, it's absolutely phenomenal being able to check on patients through telehealth, look at MRIs, CAT scans, X-rays. There's absolutely no difference at all between where I'm at, and I'm able to provide care for everybody equally.
Again, here with hand, wrist, and elbow surgeon, Dr. Keith Raskin. And Doctor, you mentioned now you are doing basically two jobs, one in New York, one in West Palm Beach. And I know that technology does a lot to make your life and your patients' lives easier. But still, what was the determining factor that made you decide to take on the responsibility that comes with working at the Paley Orthopedic and Spine Institute here in West Palm Beach?
Sure. Draw contacted me the end of the summer last year, and he said that he has personally put together 20 surgeons from around the country, and a lot have been doctors who are recognized in their field, specifically with attention in children, in pediatric orthopedics, and children with very, very challenging musculoskeletal congenital anomalies, which are problems from birth. And he said, we don't have anyone here with a real personal interest and experience in hand, wrist, and elbow in the common injuries beyond the birth issues that we're so commonly encountering here. And well, one thing led to another, and we got to speaking about that, and I promised him that I'd be able to come down here and to build up hand, wrist, and elbow surgery for the Paley Institute and make them into equally the world-class institute that they are already in so many other related fields involving orthopedics. And I have to tell you, it has not at all been anything other than a complete pleasure, and absolutely, I am absolutely thrilled to be here, especially in the company of the colleagues that I've been surrounded with and their level of expertise.
Again, here with hand, wrist, and elbow surgeon, Dr. Keith Raskin. And Dr. Raskin, I had to ask because you hold 2 patents on related medical devices used in the field of hand surgery. And I was just wondering if you could elaborate on how these devices are being used in orthopedic care today.
Sure. So one of my devices was designed to help people with very severely fractured wrists. And wrist fractures are probably one of the most common fractures encountered throughout the body. And there are times that those fractures really need to be stabilized with various types of devices. And I designed one of the devices which fortunately were able to provide a high level of reduction and stabilization of those fractures and help people through some very challenging times. The second device is equally interesting. I designed a delivery system to have patients who broke bones so severely that their bone morselized or broke into so many pieces that they needed to have bone putty or bone graft material put into that area that the bone was lost, almost like when an eggshell breaks and you don't see all the pieces because it's sort of pulverized out. And I designed a delivery system which actually would go through the skin, an injectable, allowing doctors to inject bone putty and bone graft into a fracture site to fill it, no different than you would like wood putty if you have on a construction site, you had to fill in a void that was missing. And it's been a great addition for surgeons to be able to fill in a void without having to make an incision and still have patients heal successfully.
Dr. Raskin, we talked about golf a little bit ago, and I wanted to come back to it because you're not just the average golfer mucking it up out there. You were named to the top doctor golfers in America list featured in Golf Digest. And, golf is so many different things for different people. Networking, business meetings, socialization, competition. Dr. Raskin, what do you feel like you get out of the game of golf?
Wow, I think you hit it right on the head with everything you said. Those seem to be the most interesting parts about golf. I was fortunate enough to take up golf when I was in high school, and my grandfather was a big factor with that, very influential. And from that point on, I tried to maintain it through college and med school and my residency and training. And I've been fortunate enough, I've been a member up in New York at the Westchester Country Club for over 25 years. And through the relations of the other members and specifically, along the years with different patients and different levels of care that I've been able to provide, the relationships to me have been, really the hallmark of why I love golf so much. The relationships with the other players and getting to visit different areas of the country and of the world and playing different courses has just been phenomenal. And I think perhaps one of the highlights in my golfing time was that I actually got to meet Arnold Palmer and provide some care for him and his family along the way. But I was lecturing down at his hospital, at the Arnold Palmer Hospital for Women and Children, and I did get to play with him 2 years in a row in a Pro-Am. So that was a real treat for me.
Yeah, I have no words for that, Doctor. That is absolutely incredible. I'm sure an indescribable feeling and a memory that will last a lifetime, certainly. Doctor, I got to ask you a couple more questions before you go. Wanted to get back to the Yankees because that's kind of where we started, and I'm not sure if this question is restricted because of doctor-patient confidentiality, but are there any Yankees that you particularly enjoyed working with over the years?
Well, Tex, I think, was, one of my favorites because he was, probably one of the more approachable fellows there were. And there's a few others along the way. There is some confidentiality with it, but I could tell you one thing that has been a real class organization. Everyone who I've dealt with has been super. And in fact, just as an interesting story along the way, I had the pleasure of meeting and helping take care of Tommy John, not for his elbow injury, but for another injury he had, less significant later on in his career. And just getting to meet Tommy and travel with him in different areas. He was a guest of mine at the Hand Society meeting and gave a couple of lectures to people about his injury. And seeing the response from the fans from around the world and the recognition for Tommy John was a real treat.
And then last thing, Doctor, I promise, because I know your time is precious. What is your favorite Yankees moment, not as a doctor, not as a medical health professional, but just as a Yankees fan?
I tell you, there's a lot of them, but
yeah.
I got to go down to Yankee Stadium. The first time I went down for batting practice was with Don Mattingly, and that was about the same year between Don and Mike Pagliarulo. And I got to go to batting practice and go onto the field. And if you're a real fan of baseball, go to a batting practice and stand behind the net and watch one of the warm-up pitchers just even throwing warm-up pitches in, and you get to see what the interest is on how difficult it is to hit a baseball, the amount of time between when the pitcher lets go and when the catcher has that ball. It's unbelievable. And I think just standing in Yankee Stadium and being there, and of course the year I took care of Tex was the last year or so for Derek Jeter as well, and that was a real emotional time in New York. He was such a big favorite of the fans.
Awesome stuff. Well, Dr. Raskin, I promised that would be the last question, and I want to keep my word, so I'll let you go. But again, just want to thank you for your time. This has been incredibly informative, incredibly interesting. Thanks again, and I look forward to talking to you again soon.
Hey, my pleasure. I'm glad I could be a part and hopefully help some people learn a little bit about injuries that they may be struggling with.
Again, awesome stuff from Dr. Keith Raskin, hand, wrist, and elbow surgeon, now with Paley Orthopedic and Spine Institute at St. Mary's Medical Center in West Palm Beach. And also, Dr. Raskin continues to work in New York City in Midtown Manhattan. For more information on Dr. Keith Raskin, visit paleyinstitute.org. That is PALEY institute.org. Or call the Paley Orthopedic and Spine Institute at 561-844-5255. Again, the number for the Paley Orthopedic and Spine Institute in West Palm Beach, 561-844-5255. We'll take a break, be back with more. You are listening to ESPN West Palm Tonight.